Republican members of Congress are at their retreat in Philadelphia. And much of the talk is about the next steps for Obamacare, for repealing and replacing it. Right outside their meeting, protesters are demonstrating against their plans to repeal the health care law. But some Republicans are also skeptical of a complete repeal, at least. Michigan's Republican Governor Rick Scott wants to keep his state's Medicaid expansion alive after seeing some unexpectedly positive results. Let's bring in CNN's Jessica Schneider. And Jessica, you talk to people in Michigan who are scared of what's next, and they back what the governor is saying.
Jake, they're optimistic that Medicaid expansion will in fact be saved, but Governor Snyder is in a tough spot. He's a Republican who did not endorse Donald Trump as a candidate, and now he's pushing to actually save federal funding for part of Obamacare. It is bound to be a tough sell on Capitol Hill, but the people I spoke with say that after the governor's handling of the Flint water crisis, this is a battle he better not lose.
Gia Ireland has spent all 24 years of her life in Flint, Michigan, and it hasn't been without struggle. She's suffered through the water crisis, is putting herself through school at the University of Michigan campus here while working part-time, and learned to live without health insurance when her mom lost her job in 2012.
That's when it became like, wow, we don't have anything.
But 3 years ago, the state of Michigan threw her and thousands more a lifeline. Under the Affordable Care Act, Republican Governor Rick Snyder opted to expand the pool of people eligible for Medicaid in a program called Healthy Michigan. It opened up to people ages 19 to 64 for individuals earning $16,000 or less and families earning $33,000 or less per year. Suddenly, it wasn't just people at or below the poverty level who could enroll in Medicaid. And despite the Supreme Court's ruling that states weren't bound to take part, 16 states that have taken the expansion have Republican governors.
It wasn't the generic expansion. We actually added requirements for personal responsibility and wellness on the front end.
Governor Snyder is now fighting to keep federal funding for the expansion. Since launching the program in 2014, more than 600,000 people have enrolled in Healthy Michigan, far surpassing the expected enrollment of 470,000. Snyder, along with 9 other governors, met with the Senate Finance Committee one day before Trump's inauguration. He says Michigan has experienced a 44% drop in uncompensated care days at hospitals statewide, illustrating the importance of the program.
You're seeing the savings here in Michigan. But will that translate down in Washington when they're deciding how to dole out the dollars?
This is the best case I've ever seen in terms of Congress wanting to listen and actually have a positive dialogue with the states.
You didn't endorse Donald Trump. Do you worry that that may bode unfavorably for you and hence the residents of Michigan?
And I haven't seen indications of that.
Snyder says he has not spoken to the president.
I was working, 65 hours a week and barely making ends meet as it was.
But for people like Robin Mead, who had life-saving brain surgery thanks to Healthy Michigan,
getting the insurance approved is definitely what made me have the surgery. And that's really the reason that I'm still here today.
Hurry up and I get off for you this close to me. I kind of like it.
It means her 3 children don't have to live without their mother.
We need it, especially in Flint.
Gia Ireland graduates in April when she hopes to get a job that offers health insurance. But in the meantime, she's looking to Governor Snyder to save the expansion.
It does show that he has some sense of humanity and cares.
President Trump's senior advisor, Kellyanne Conway, said this week that the White House is entertaining the idea of converting federal funds for Medicaid into block grants to the states. Right now, the government is actually funding 100% of Medicaid expansion costs. Now, Michigan Governor Rick Snyder, though, tells me he does not favor a block grant, saying the government should be working with states to allow and encourage them to create programs that focus on accountability rather than just dollars and cents. Jake?
All right, Jessica Schneider, thank you so much.